The Greater New Bedford Community Health Center monthly video series is brought to you by Senior Whole Health, a health plan for seniors that have both Medicare and Mass Health coverage. Online at seniorwholehealth.com.
Welcome to the Greater New Bedford Community Health Center. We will be presenting a series of seminars which we hope will inform the community and our staff about the benefits which are available to the people that we serve.
I want to welcome you to the August series of the Greater New Bedford Senior Services Seminars. Today we're very fortunate in having two speakers. The first one will be Michelle Beneski, attorney Michelle Beneski, who will speak on how can an elder law attorney help. The second will be Chris Gidwani of A+ Home Medical Supply Company, and he will speak for about 10 to 15 minutes following Michelle's presentation. Thank you. Thank you for coming.
Thank you for having me here. My name is Michelle Beneski. I know a lot in the audience know me. I'm an elder law attorney, and I practice here in New Bedford with my brother, Dan Serpinaut, and my dad, Bob Serpinaut, and we have an associate, Brandon Waleka. What they asked me to speak about today is how can an elder law attorney help you? A lot of people have never heard of an elder law attorney, so let's start with what is an elder law attorney. An elder law attorney is really someone who specializes in working with seniors primarily, although it's a segment of estate planning, and they assist in applying for community and long-term Medicaid, which can provide services both at home and in a nursing home, Medicare, we answer questions about that, and many other government programs that people may need as they get older in order to receive health care and other kinds of support. And because these are things that don't come up until you're older, most people are not aware of them. We also advise about Social Security disability, and other public and private retirement benefits like IRAs, 401ks. We are not financial advisors. We don't tell you what to invest in, but we can advise on how that is going to affect your life going forward if you select a particular option. You know, some people consider retiring and collecting at age 62. Others decide to wait later. We answer questions about those kinds of things. We prepare wills, trusts, powers of attorney, healthcare proxies, and other types of estate planning and healthcare documents. I want to say right now, the big question you should ask yourself is not what happens when I die, but what happens if I don't die and I become disabled or I become sick. Healthcare proxy, which you can usually get for free at the hospital, maybe some council on aging, is a very important document that you name someone else to make your medical decisions for you if you are not competent to make them for yourself. And a power of attorney is a document drafted by an attorney that allows someone else to handle your legal and financial issues if you can't handle them for yourself. And with both of those documents, a lot of the time, 90% plus, you can avoid the need to have your family go into the probate court and obtain permission to manage your health care or manage your finances. And those processes are what the next thing is: guardianship, conservatorship. We do go into court, the probate court, and obtain guardianship, which is a legal power given to someone to manage the health of someone else, and conservatorship, which gives someone the legal power to manage somebody else's finances. And we do that for our clients, but it's never fun. It's very expensive financially. It's very emotionally draining because the person who you are managing it for, you're taking over and they are declared legally incompetent. And you can avoid that by seeing an estate planning or an elder law attorney and getting your health care proxy, your power of attorney in order. Very important. We help families administer estates. And when I say we, I mean the generic elder law attorney, estate planning attorney. Of course, our office does it, but that's what we do. Advise and assist in buying long-term care insurance and supplemental health insurance, like, do I need the Blue Cross plan or the AARP plan? Have you noticed any difference with your clients? The clients ask us that all the time, and we can help them evaluate that. the drug program D, we usually send them to talk to their SHINE officer, but we explain what the process is and what they should bring with them in order to pick the proper drug plan. And we advise in obtaining and maintaining public disability benefits, including special supplemental needs trusts. A lot of folks don't realize if they have a loved one that maybe is receiving SSI, which is Social Security Supplemental, or SSDI, and Medicaid, they're afraid that if they leave them some type of inheritance, that person can lose their benefits. And through the use of planning, you can leave a nest egg for a disabled individual, and they don't have to lose their benefits. And that's a really important part of the planning that we do. A lot of people think disabled children. With my clients, the disabled child is probably in their 50s or 60s, and the disabled parent, the parent is in their 80s, and they've been taking care of this child, and the child probably lives at home for their entire lifetime. Now mom or dad or both are getting sick, and they're wondering what's going to happen to my disabled child. I don't want the child to lose their Medicaid. I don't want them to lose their SSI because they won't have anything to live on, but I don't want to cut them out. We can help with that, and there are ways to plan about that the law allows. We assist individuals and their families to prepare for the legal challenges of getting older with the goal of keeping a senior's independence and allowing for loved ones to take care of the senior without court involvement. That's really a big goal of ours. Help our clients be independent for as long as they can, help them get the support and the services that they need. We work with tons of community organizations. Obviously, we're not nurses, we're not social workers, but we tie in very closely with all of those organizations, with Coastline, with Bristol Elders, so we can know what they do and refer our clients out to them, because a lot of seniors within the community unfortunately just don't know what's out there for them. And a lot of elder law attorneys, do just like we do, and they make sure that they understand what's out there and what can be provided to help that senior stay at home and stay independent. And then we help the families take care of them when it reaches a point the senior can't take care of themselves. We do guide families to shield assets from the cost of long-term care, both with pre-planning and crisis planning. We do trusts that can protect your home so that if you go into a nursing home, it's not liened. We do the same kind of thing with financial assets. If you have a loved one who's in the nursing home on Medicaid, you don't want to have your traditional I love you will and leave everything back to that person. We help people plan around these things and guide them so that the outcome that they want can happen. Make sure that the nursing home patients' rights are respected and that they're getting quality of care. We've had clients that have gotten us involved in having talked to the ombudsman and other things so that they're getting the care they want. And we represent clients in disputes involving nursing homes, Social Security, Medicare, Medicaid, and managed care. And we help address instances of elder abuse or fraud. We help with applying for veterans benefits. A lot of folks don't realize what veterans benefits are out there, particularly for wartime veterans, and we help them with that. You can't charge for doing a veterans benefit application, so we do them for our clients. But those people who aren't our clients, we make sure that they get a referral to a good veteran service organization that can help them. And usually we let them know, yeah, go talk to them because you probably do qualify, because we can see that off the top. We assist in avoiding the probate of assets at death. Probate is the court process whereby something that's in your name alone is transferred to someone else. It takes about a year, can cost a few $1,000s, and there are a lot of things, even short of a trust, that can be done to avoid probate. So we help our clients structure things to avoid probate. And we assist in minimizing or eliminating estate tax at death. A lot of folks don't realize that there is an estate tax. Massachusetts has an estate tax that's imposed on your property when you die, and it's $1 million or more in property. So if I own dying $1 million or less, I pay no tax. If I die owning $1,500,000, I'm going to pay $50,000 in taxes. And there are ways, especially with married couples, to minimize or eliminate that. And that is more on the estate planning thing of elder law, but elders are going to pass and they're going to have some assets, and we can set things up so that they can minimize those taxes. The tax laws are changing, And the Medicaid laws are changing. The veterans benefit laws are all changing this year. It's a little crazy, and we spend a lot of time keeping up and making sure that our clients know what is going to happen. And then, of course, we assist in administering the estate after death. If we've done our job right and we've worked with our client before the client passes, it can be very easy to pass things on after death. And, very simple. If a client comes to us, the family comes to us, and we didn't help with that, it can be pretty involved. So it really depends. How do you find an elder law attorney? The preeminent organization is the National Academy of Elder Law Attorneys. It's a national organization. We have a Massachusetts chapter here, but you can go on that website and you can look up an attorney, and they'll have a whole profile on them, geographic location, phone number, contact information. We are really blessed here in Massachusetts. It's one of the states where the whole development of elder law and the subsection of law occurred. And we have some of the best, I think, elder law attorneys in the whole country here. And so that has made training for the rest of us really good, and very good resources for seniors no matter where you are. The other thing, though, is just because you're part of NALA doesn't mean that you do a lot of elder law, because anybody can join. And that, to me, is a little scary. So when I refer out, because I get calls all the time for people, say, in Florida or California, I always look to see if the person's a certified elder law attorney. And a CELA is someone who has met a certain level of experience in elder law cases, and then they passed a test administered by the National Law Foundation. And that's the only certification recognized by the American Bar Association. I'm one of 2 CELAs here in Bristol County, and there's only 20 in the state of Massachusetts. There's probably 40,000 estate planning attorneys, but there's only 20. But if someone has that designation, that they have taken the time to really concentrate on this area of law, and they have to keep up their education and experience levels. You have to recertify every 3 years. So questions to ask an attorney if they're not a CELA: what percentage of your practice is estate planning? What percentage is elder law? Because they're slightly different. How many mass health applications have you filed in the average week or month? A good elder law attorney is going to be filing, at least once a week, maybe 2 or 3. If they said they did 2 last year, you might not want them because they might not have kept up with what's going on. Do they charge hourly or a flat fee? There's no right or wrong with this. Most elder law attorneys do flat fees, but some still do hourly work. And how many hours of continuing education do you go to each year? I would say you would be looking for a minimum of 10 hours of continuing education because, like I said, this area of the law is changing all the time. And if they said, oh, I haven't been to anything, or I go to one CLE update, for 3 hours once a year, that's not enough to keep up with this. But there are lots of, good elder law attorneys here. We're lucky. I have a very quick example for you of something because some people are more visual. We have Mary and Ted. They're age 67 and they've done no estate planning. Just off the top of my head, what we would always recommend is that power of attorney and healthcare proxy. A living will, it's not legally binding in Massachusetts. That's a document that you say what your wishes are if you die. I want to be buried, I want to be cremated, I want life support, I don't. We don't recommend this for the doctors. This is for the family. I'm one of 6 kids. If my mom is in a coma, there's going to be 2 of us saying that we want her to have life support and 2 saying we don't want her to have life support. And if my mom wrote it down, there won't be any fighting. So this is really for the family. I have seen it help. I had a family that was fighting over whether or not to cremate somebody. And because the person wrote it down, they respected those wishes. So again, not legally binding. Your healthcare agent can make any decision they want, not for the doctors, but helpful for the family. A HIPAA release at a medical facility. You guys all know what HIPAA is. It maintains your privacy in your medical records, but if you're helping a parent or a spouse with a lot of medical issues and you're dealing with more than the primary care physician, it can sometimes be helpful to have them sign a broad HIPAA release and fax it over, and that will allow you to speak directly to the doctors and the nurses and get test results. a last will and testament that tells you where your property is going to go. And if they were interested in protecting their assets, their home, from the cost of long-term care, we would probably look at something called an income-only trust to protect the house and maybe some other assets. Ted has a stroke. He needs home care. What would an elder law attorney help with? A community mass health application so he can get benefits at home. Veterans benefits if he were a veteran to help pay for home care. And hopefully there wouldn't be any need for guardianship or conservatorship because he did the primary documents. Otherwise, they would need help with the guardianship. He needs nursing home care. An elder law attorney is going to help with the long-term care application. Hopefully that they've protected their house, and that's going to give them some peace of mind and some assurance to making sure that Mary, who's at home, keeps as much of the family assets as possible, hopefully beyond what's normally called the community spouse resource allowance. Most elder law attorneys, if you have a married couple, can protect pretty much all of the family assets for that community spouse. The law says that they're allowed $114,000, but there are many exceptions to that rule, and those exceptions can benefit a spouse at home because we don't want to impoverish a spouse at home. And most elder law attorneys know how to do this, and that can be a very big benefit for the family member who's at home. Mary dies. We want to make sure that she doesn't leave everything directly back to Ted. So most of her assets would probably pass outside of probate, and an elder law attorney could help do that. They could leave some assets for Ted, but leave it in a protected trust so that it doesn't affect his benefits, assist with minimizing any estate taxes, and assist with settlement of the estate. Those are the kinds of things that an elder law attorney can do for a family. And it's something that's important to take a look at when you're hitting retirement age because your life is changing, and the laws in this area change a lot, and some things need to be done in advance. And the sooner you get on it, the more likely it is that you will have good outcomes if you become disabled or when you pass. It can make a lot of difference, both financially and emotionally for families. And that's why elder law attorneys do what they do. Any questions?
I've noticed that the programs and the documents that should be filled out after a certain point are probably being thought of maybe a little bit too late. And so I'm wondering, what age are most of your clients, or the beginning of your clients, and what age would you recommend people to be doing it?
I recommend a healthcare proxy and a power of attorney to everyone over the age of 18. Because they can get in a car accident. I have a 19-year-old daughter, and there's nothing I can do if she, becomes incompetent. Once you have some real property, you probably need a will. When you're looking at asset protection planning, most of my clients are age 50 plus. That kind of planning really depends on your family. I've had some clients who've told me they're 58 and they look like they're 80, and they're like, nobody in my family lives past 67. Okay, we'll do planning for you. And then I've had other clients come in at 80 and they're like, I'm gonna live another 20 years and we'll do planning for you. So it's very individualized, but I would say in your mid-50s is a good time to at least get your basics done. You may not take an extra step of, say, creating a protection trust, but you'll make sure that if you become disabled, now that you're getting a little older and you're higher risk for things like stroke, diabetes complications, things like that, that your family will be able to take care of you if you become sick.
The other question I have, though, is about when someone is starting with early stages of dementia and to the point where they haven't necessarily had their things taken care of, and now their family doesn't have the power to speak on their behalf or to help make decisions for them, and they're right in that cuspid. How does that usually handle? I mean, to whom should they? Should the child go to somebody like yourself to request assistance to get their parent to be engaged and tested, or?
Yeah, the question was, what if somebody has mild dementia and they've kind of reached that point where you're not sure if they're competent or not, and maybe they haven't been to the doctors or whatever, who should they reach out to? You want to reach out two ways. You got to get to the doctor. You got to get to a neurologist and have some testing done. Most elder law attorneys will make their own judgment as to competency to signing documents. It's my bar license that's on the line if I sign documents with somebody who's not competent, but it's not the same thing as medical competency, so we make that evaluation, and if possible, we'd like to get that healthcare proxy and power of attorney in place so you don't have to get guardianship. If we say that person's not competent, then the medical doctor is going to have to give us a medical certificate, and we're going to have to go into court. And I believe that's the last question. I think I need to wrap things up. Thank you for having me. I'm around if you need anything, and I left some materials in the back if it's helpful.
Thank you, Michelle. We'd like to have Mr. Chris Gidwani of A+ Medical Home Supply speak to us. Thank you. This was very informative, by the way, on the elder law. It's very important. Come on.
Good afternoon, everyone. How's everyone doing today? Outstanding. My name is Krishna Gidwani, and I'm from A+ Home Medical Supply. We're a durable medical equipment company here in New Bedford, and we've been in business for 4 years. We supply things like wheelchairs, hospital beds, walkers, diabetic supplies, ostomy supplies, and diabetic shoes. I myself, I'm a certified podorthic, and I work predominantly with the diabetic shoes and inserts. Today I'm talking about diabetic shoes and the process that people go through in order to get diabetic shoes. When a doctor sees their patient and they notice that they're having issues with their feet, it can be anything from poor blood circulation to diabetic neuropathy to having wounds and sores on their feet. Their feet need extra protection, and usually this is after the fact. We try to get to them before things like this begin to happen. And what happens is it can happen within 80% of the people who get issues can sometimes end up with amputations. And the point is to prevent that from happening. The insurance companies would rather pay for a pair of shoes that are protective and comfortable for the patient than have them develop a wound that will require months of healing and months of treatment. So to the insurance company, this is a preventative act. So when the patient is diagnosed with these issues, they're then sent to us, and then we take a look at a couple of different issues. We look at their gait, we look at how they walk, and where they're applying a pressure to their feet. So some people might be overpronated, where they walk on the outside of their feet, and there are issues when where they'll walk more on their heel, and you'll see pressure marks actually on their shoes. So you'll see parts where it's kind of rubbed out. So from that, you can kind of determine where the pressure points are in the patient and where the skin is most likely to break down. The goals for orthopedic shoes is to make sure that they protect the patient's feet and make sure that they're comfortable and that these rubbing spots don't happen, so that these red spots don't occur that can turn into extra wounds. So that's the primary goal of these orthopedic shoes. The next part of it is once we assess their gait and we take a look at where their pressure points are, we start to measure them for shoes. What I tend to see in the community is people either going barefoot in sandals. I see them wearing shoes that they've been wearing for the past 3 years, shoes that don't fit correctly, and shoes that are simply just not appropriate for people who are diabetic to protect their feet. So when they come in, we can help educate them on their shoe size. We can educate them on foot protection and help them get more educated and ready to take care of their feet in a better process. So we work through them with that process. The shoes take between 3 and 4 weeks to get, depending when we get the prescription from the doctor. And once the shoes come in, the patient comes in a second time and we do a fitting. We make sure the shoes fit comfortably. We have them walk around in it. If there are any issues or adjustments, we do those adjustments at that time. It's a really quick, easy process. We have a location on 92 Grape Street, right across the street from the hospital, and we see patients there, and I also do home visits as well for patients who are homebound. That's it, because I know this was going to be a quickie. And is there any questions or anything that I can answer for anybody? Yes, ma'am.
Just the cost, is it covered by insurance?
It's covered by insurance. Medicare will cover their 80%, and the secondary insurance will cover the other 20%. If there's not a secondary insurance, usually that 20% will be covered by the patient, and that can range from $27 for the shoes and then up to $77 to cover the shoes and the inserts. But it's relatively inexpensive compared paying $27 for a pair of shoes at the store already, but you're paying for a pair of shoes that will actually fit you properly. Any more questions? Great, and I too left some materials out on the table. My name is Krishna Gidwani from A+ Home Medical Supply. Thank you all for coming. This was terrific. Thank you so much.